I'm Dan Berman from Cedars-Sinai Medical Center, where I'm the Director of Cardiac Imaging. Today I talked about positron emission tomography as it's used for myocardial perfusion imaging in coronary artery disease. I emphasized the role of a new agent, FLURPIRIDAZ F18, that has distinct advantages for PET MPI. In general, PET has been shown to be superior to SPECT in terms of diagnostic accuracy and its ability to measure absolute flow rates. One of the distinct capabilities that SPECT does not yet have is the ability to get around the problem of looking only at relative perfusion defects, to be able to look at absolute perfusion defects so a region is compared to itself. That increases the ability to detect high-risk coronary disease and to assess prognosis. I emphasize the role of a new agent, this FLURPIRIDAZ F18. It's in phase 3 clinical trials at the present time. We recently conducted the phase 2 trial and reported it in the Journal of the American College of Cardiology this year. FLURPIRIDAZ appears to have ideal characteristics as a tracer for myocardial perfusion imaging. Labeled with F18, fluorine 18, it has higher resolution than is achievable with the other widespread agent, rubidium-82. Its most important characteristics is that it's extracted linearly across the range of achievable blood flow. Other agents, such as rubidium or the SPECT imaging agents, plateau off as flow increases. This plateauing results in difficulty in assessing the presence of mild coronary stenoses that may only reduce slightly the degree of hyperemia that is achievable through the vessel. Because of its linear extraction across the range of flow, detection of mild perfusion defects appears to be possible with FLURPIRIDAZ, and the degree of hypoperfusion may be more accurately reflected by the degree of decreased uptake. In our phase 2 trial, this resulted in increased sensitivity for detection of coronary artery disease. We also observed increased diagnostic certainty of the interpreter due to image quality improvements and to the more marked impact of perfusion defects on image appearance. Furthermore, we evaluated the degree of ischemia that was noted and found that the degree of ischemia in patients with coronary artery disease was nearly double that it was with SPECT, while in patients without coronary artery disease, there was equal lack of detection of ischemia as would be expected. I believe as time goes forward, we will see this agent, after approval, playing a very important role in the further development of PET for myocardial perfusion imaging. To summarize my presentation, overall, I was suggesting that for diagnosis and prognosis, there are advantages to SPECT myocardial perfusion imaging. Because of the availability of rubidium-82, which does not require a local cyclotron, PET scanning of myocardial perfusion is becoming more widespread. In the future, with the use of this new fluorine 18 labeled agent, it may be possible to have even a greater dissemination of the technique, since this new approach can be used with single patient unit dose acquisitions rather than requiring a large volume of studies to be done. PET scanning for myocardial perfusion imaging has an excellent future.